at the first healthcare show in the Rockleigh Country Club. I am Chaim Lowy, CEO of Capital Alpha, and I'll be your host today. Capital Alpha is a value-oriented, fundamentals-driven, healthcare-focused private equity and advisory firm. We synthesize financial analytics, operational savviness, and sophisticated deal negotiations. We've transacted across thousands of beds in diverse markets and create responsible outcomes across the board, from investors to debt holders, managers, and even those ones that a lot of people don't think about, the patients. In finance terms, the meaning of alpha is the excess return of an investment over the benchmark. In my terms, it's the edge that one has over the market by being vigilant, sophisticated, and proactively ahead of the 8-ball. Maximizing alpha is what inspires our shop, and it's what inspired today's panel over here, where we'll be focusing on maintaining that edge in the alpha focus. Today we have the special privilege of having several superstars who each live on different planets to talk about the real challenges in today's market. We're going to start with having each panelist introduce themselves, including what they do, and something that nobody here knows about them. And we're going to start with Ken.
Thank you, Chaim, and thank you, everyone. My name is Ken Milgraum, the Vice President of Finance at Apex Global Solutions. Apex is outsourced back office. We take care of anything financial related for a facility so that facilities can focus on running their facilities properly and patient care. We take care of everything else that a corporate office would do. Something interesting about me is I have the best team in the world with a lot of people here today, and I'm very, very appreciative for them. Thank you.
Fun fact about Apex, they don't only do the things that the back office people should do, they also can do the things that the front office people should do, if you ask them.
Ken, Chaim said that you're supposed to say something that people don't know about you. We already know that.
Hey, I'm Matt Welik. I'm the CEO of Healing Partners. Healing Partners is, thank you. Healing Partners is a premier wound care practice that services about 1,000 nursing homes across the country. One thing that I guess people, first of all, I have to say, it's really inspiring to speak in front of such a diverse crowd. I heard there are even people here from other states other than New York, so that's really inspiring. New Jersey, wow, unbelievable. One thing that you might not know about me is that I actually got into the long-term care space kicking and screaming. I come from the hospital world originally, so being in the long-term care space is a mistake that turned out in my favor, hopefully well, and I hope for the population we serve. I hope we help to improve things out there. So.
Hi, I'm Alan Schabes. I am a healthcare transactional and regulatory lawyer with Benesch Friedlander. Benesch Friedlander is a national law firm that has a very large healthcare practice that includes the representation of a whole range of providers from hospitals, nursing homes, all the way through home health and hospice, all the way through the post-acute care continuum. A fact that very few people know is that I did try out for the National Basketball Association, and I did not make it.
Center?
Yeah, the dunking contest in 1899.
It was a different game then. Hi, everybody. I'm Andy Aronson. I'm the president and CEO of the Healthcare Association of New Jersey. We are the largest association that represents long-term care providers in this state. I'm happy to represent many of you who work in this space. I guess, fact about me, my first job in healthcare was when I was in high school, worked in Fort Lee, right up the road here, stuffing envelopes for the New Jersey chapter of the Alzheimer's Disease Society, which was run out of an accounting office here in Fort Lee. So a long time ago, but that's where I started. So thanks for being here.
Sim Goldberg, MERIDIAN Capital Group. Very basic. We just do all of the debt that there is across the board. If you got a deal done, it was through us. Just that's how it works. Something that people don't know about me is that we right when Chaim reached out and asked if I'd be on this panel, I said only if I'm the only one with hair. And he
that wasn't a hard thing to do.
came through. Definitely came through.
My lack of hair is by choice.
That's because you've been doing this less than we have.
Every person here could be my father.
Well, I'm happy I don't have to share something with you that you don't know about because I'm a very quiet person and I would have filled up the whole 45 minutes with surprising stuff. But we're going to jump right into these interesting topics. So, up first. While interest rate direction is not the core focus of our roles, the impact of recent interest rates has ricochets throughout every industry. It affects everyone, and we find all business owners forced to make bets relating to the direction of interest rates. Aside from the increased benchmark rate resulting in the higher cost of debt, obvious, in what other ways do you see today's interest rate environment changing the current landscape of our industry? And I'm going to start with Ken.
Thank you very much. So, for the last 9 months, everyone's been hearing every deal dying across the board. We've been hearing that interest rates are causing the valuations to come down, but the sellers aren't ready to allow that to happen. So, in order for deals to actually go through, and we've actually seen in the last couple months, the buyer and seller have to work together to create a structure that makes sense to actually go through, sometimes with the help of a lender, but sometimes by being creative. So what we've seen is a tremendous shift to lease to buy. Lease to buy is like the #1 way of closing a deal now, where the buyer is agreeing to lease the facility until the financing comes through down the road, and Sim's team gets comfortable with it.
Listen, I'm going to jump in here. This is sort of my world. We're not in the business of talking about rates. We're the finance people, but when it comes down to it, in any market that you look at, rates are rates. You see McDonald's, for example, will look at the price of corn and see that there's fluctuations across the board, and they'll lock in a price right now. They don't care that maybe it'll come down at some point in the future. They need to look at a deal and say, this works for me right now. So if anyone is really looking at a deal, you can't really bet on a rate fluctuation or this deal makes sense because in 6 months the rates will drop. It really does need to make sense today, and if it doesn't, it should be something that frankly you're running away from. But I mean, rates increasing has affected everything. You look at Propco guys, and they're no longer interested in doing deals because their lease is equivalent to what their debt service payment is. So why would I go in and put my money into something where I'm break even? That really doesn't have any sort of effect. But I think the biggest effect that it's having is like Ken said, it's lease to purchase. But in an industry that has for the last 13, 14 years had so much growth and so much new blood, the fact that there is no ability for young new blood to get into this industry is frankly terrifying, because if there's no growth and there's no additional people coming in, then it's just going to really, hopefully not, but in my opinion, it'll definitely stale and potentially fail. So there needs to be some sort of an option for the younger people to get in. And yes, lease to purchase is some way for them to, down the line to figure something out. But in our opinion, there needs to be something that, can be done today.
I think over the last few years, what we have seen is an almost insatiable desire for people to purchase nursing homes. It's almost like the lemming effect. In other words, if I see all of these other people who are ostensibly making lots and lots of money, and therefore I should be able to do the same thing. And there's not a week or two that goes by where we don't get a call from someone saying, well, I would like to buy 3 nursing homes or 5 nursing homes or 10 nursing homes. And the first question that I ask them is that, what do you know about running a nursing home? And there's like silence on the phone. And the answer is that running nursing homes is a very difficult thing to do, with a lot of upside, with even a greater amount of downside. And what I'm seeing as a result of the interest rate increases is that I'm seeing lenders becoming very, very uncomfortable very quickly. We have in our office today at least 3 receiverships of major chains that are going on right now. We're seeing a lot of facilities that are changing hands involuntarily, and we are seeing people close homes for the first time in a number of months and years, really since COVID. Because when COVID came in and the money was flowing like water, everybody was really happy and the interest rates were very low and everything was good. But now everything is not so good. And we are seeing people walk away from facilities, closing facilities, and it's really a very intimidating time for people who are locked into these variable rates with personal guarantees. It's a very difficult time, and one that people need to tread very carefully before getting into these kinds of situations.
Yeah, and it's not just interest rate volatility, right? Because interest rates are going up, so things get more expensive. But staffing costs are going up and getting more expensive, and operating costs are going up and getting more expensive. So those people who are entering into these deals saying, well, I'll go through the regulatory process, or I'll go through the financing process, and I'll take over a facility in a year, the costs are 20 or 30% higher that year down the road when they take it over, and they haven't planned for that, which is a big issue.
Okay, so the next question is going to be kind of a rapid fire, okay? Don't overthink it, just spit it out, okay? And the reason why we're doing this is because it's a topic where we could really spend so much focus on pointing the direction, but in our day-to-days, we're forced to make quick decisions based on it. So, it's a very simple question. When you're looking at the next 3 years, which is a typical bridge loan horizon, would you expect, in the general sense, that rates are going to go up, rates are going to go down, and where's your scale of certainty? 10 being most certain, 1 being least certain. I'm going to start with Sim.
All the finance questions are going to come at me. So it's really great being on a panel where nobody else is in the financing markets, because anything I say, I'm not going to be fought on. But
Ken, you want to talk about finance and markets a little bit?
I mean, I could talk to you guys about Medicare rates. They're definitely going down. So.
It's a difficult question, right? I mean, 6 months after COVID, we all thought that occupancy was going to skyrocket. And we thought there was going to be all these deals that came out at the end of COVID. So every single thing that we thought was going to happen over the last few years hasn't happened. So to say, yes or no, will they go up, will they go down, that's difficult. To my previous point, make sure the deal works for you today. That's the right route, and yeah, very likely that they'll go down. That's what all of our lending partners are telling us. That's where, swaps are coming in, and frankly, it really does have to go down. I don't want to get political here, but if it goes red, yes. If it goes blue, no.
I'm interpreting that as like going down with a 6.5 out of 10 confidence level-ish.
Yeah, that's fine.
Andy, what do you think?
I don't know about interest rates. Reimbursement rates, Medicaid is going to go up over the next few years, which is nice. There will be more Medicare managed care in long-term care. That's going to grow. Whether that's going to push Medicare rates up or down is a good question. I think maybe down in the short term, maybe up in the long term. So it's kind of an unknown. But I think from a revenue standpoint, I think occupancy rates will go up in the next few years. I think Medicaid rates will go up. I think Medicare rates likely coming down a little bit.
So I don't know much of the way in terms of what interest rates are going to happen. I have been in this industry long enough to know that I have actually seen 12% and 14% and 15% interest rates.
It's not impossible.
It's not impossible. I don't think that's going to happen. But I'll tell you what is going to happen. And I agree with Andy a lot. I think that Medicaid is going to go up in the very short term as the governments begin to spend more money that way. I think Medicare is going to moderate. I think what you're going to see is a lot of people pushing into value-based care. In other words, if you're going to provide quality care and with quality metrics, you're going to get paid better for that. But if you're not going to be able to hit those kind of quality measures, you're going to suffer. And you're going to suffer in your ability to attract admissions, and you're going to suffer in your ability to get payer contracts. What is going to go up is the cost of doing business. Staffing is not going to go down anytime soon. The cost of food and cost of everything else is not going to go down anytime soon. And what's also not going to happen is that you're not going to have the COVID money coming in. Those millions and millions and millions of dollars that came in, that was once in a century. It's once in a lifetime. That's not going to happen. and it's going to force every provider to really operate within their means and to do so the best way they know how.
I think just to echo on what Alan's saying, I think in addition to the Medicare rates sort of stabilizing, I think we're also going to see sort of what Andy's saying, a huge increase in MA. If you look at Medicare Advantage across different states, like there's still some states that have very low Medicare Advantage penetration, and as value-based care is pushed more, Medicare Advantage is going to become much, much more highly sort of contested in the market out there, and you're just going to see so many more people like we saw in Florida right now, where there's like a 75% Medicare Advantage penetration. So, I don't think any other state, maybe California has a similar other number than that, but all the other states, there's huge growth in the Medicare Advantage population. It means that for operators, they have to start looking at how do we individually contract with Medicare Advantage plans, and how do we start, not only from a census perspective, but also from a working in continuums of care, to be able to be sort of a preferred provider within Medicare Advantage. I think that's going to be a huge change in the industry, and it's going to require a different level of skill for how do we go out and contract to get the right rates. So.
You can't predict interest rates. I agree with everyone that said, and when you're running the business, you're running a healthcare company first, and you have to make sure that you're set up properly to work, to run the facility properly. So, like Alan referenced multiple times, you can't run into the business thinking that it's lucrative, other people have done it, other people are throwing huge parties, I'm going to do the same. You have to approach it from smart decisions, a business model that makes sense, a pro forma that's going to be realistic with enough working capital when you get started to be successful, with a partner that has done it before.
And I think getting knowledgeable about the various hedging instruments that exist out there may be an important tool for people that really don't know which direction this is going to go and are looking at it based on how everything is situated right now. So as several of you alluded to, considering all these macroeconomic complications we're all dealing with right now is more important than ever to be innovative and maximizing profitability on our operating platforms. One of the large industry movements is to capture value in cost centers by either bringing expense departments in-house to reducing costs, or creating JVs to share in some of that alpha that the vendors are achieving on our populations. What are some of the key nursing home cost centers where you see some of these JVs happening? What are some of the practical challenges that might not be visible initially on the surface? And are you a fan of going down this path? I'm going to start with Alan.
So there isn't a week that goes by that I don't get a call from either a vendor or a nursing home owner that wants to talk about a joint venture. It seems to be the thing to do today. And I could talk about joint ventures for another 2 hours, but nobody wants to hear me talk about joint ventures for the next 2 hours. What I can say about joint ventures is that they can work under the right set of circumstances, for the right purpose, with the right structure. What do I mean by that? There are certain things that nursing home owners will want to incorporate into their panel of services that make perfect sense. It is logical and understandable, even to a regulator, for a nursing home company to enter into certain kinds of businesses. Like, what kind of businesses would that be? For example, primary care physicians and nurse practitioners. Makes perfect sense for a nursing home company to have a joint venture to have nurse practitioners or primary care physicians into that facility. Why does it make sense? Because it enhances care. The government understands that the more medical professionals that you bring into a nursing home, the better the care that will be, the better the outcomes will be, the better the quality will be. That makes perfect sense. I have yet to have a venture that does that kind of a purpose be challenged by the government. Other things like therapy companies, where you have an ability to control the therapy that you're providing, you have the ability to really bring in some quality people, that makes sense too. Let's look at some of the cost centers where people are spending a gazillion amount of dollars. And the one that I hear all about, let me do my own pharmacy. Oh, pharmacy costs are astronomical. The institutional pharmacies are just charging me an arm and a leg, I'm going to do pharmacy on my own. There isn't anyone who doesn't operate a pharmacy who knows how complicated it is to run an institutional pharmacy. It is one of the most difficult businesses to run. So while theoretically it makes a lot of sense, unless you have at least 4,000 beds in a pharmacy, you are going to lose money. I guarantee that you will lose money. And people think that it's this panacea. But there are other types of ventures that are out there that don't make a whole lot of sense. I mean, I had one person who wanted to get into a joint venture with waste management. Like, why?
That must have been the biggest ticket item on their day.
Yeah, and the other thing to be careful of with joint ventures, related party transactions, all of these different things that are going on, is there's going to be increased government oversight of those transactions. So there's going to be increased transparency of the costs and the fees associated with all of those transactions, and there's going to be increased scrutiny to make sure that they're used properly. You know, as Alan said, number one, improve quality of care, great, fantastic. Number two, reduce cost, right? A good joint venture is going to reduce cost to the nursing home and increase the quality of care. If you're increasing the cost to the nursing home through a joint venture or a related party transaction, it's a giant red flag for people to look at. So this idea that, hey, I can squirrel away all these profits through a joint venture, and I'm really not paying that much more than I was paying before, people should be happy with that, is really not a good mindset to go into that with.
So I think also you have to think about who's operating these joint ventures. You know, so often it's like, let me get my brother-in-law's kid's sister's, the kid's like literally straight out of diapers, and now he's going to be running Alan's pharmacy, and like it just doesn't work. So and I think the other thing is when you think about who's out there and they're operating these other companies, it's part of what it is when you're running, I am one of these guys that run one of these companies, but part of what you're doing as a CEO of a company that's doing ancillaries, I'm sure there's a lot of you guys like me out here, every day I wake up and I'm thinking, how do I build value for my investors? And sometimes what it takes to build value is long-term investments, and long-term investments eventually pay off, and everybody's in there for the long game. But it's not something that's an immediate answer to my margin in my nursing homes went from 8% margins to now I'm down to 2% margins. Let me go into some other random business. That's not the right approach, in my humble opinion. It's not the right approach to building a successful ancillary business. Successful ancillary business is all about building long-term value for the patient itself. And I think that both from a regulatory angle and from a legal angle, it's really important that be the focus of the company. And if you're doing that, if you're building value, then I think there's a lot of business books out there that would say that's how you build a long-term successful business. But the quick wins in ancillary businesses, I think it's really, really short-sighted. There are some that are out there that do that, they get in, they get out, and maybe that works. But I think that's not, the people that would run those types of businesses and the way to really build a long-term, very, very sustainable, valuable business is to really go in and to say, this is really an investment that I'm in for the long term. And if operators are willing to do that, they're a very, very attractive partner to an ancillary company. I think without that, it's a real challenge on both ends, both operationally and for the investor themselves to get out what they want.
And a lot of times these JVs and some of these ancillaries, it's an all or nothing thing. You can't have your own NP shop and also have other NPs coming in there. On an operational standpoint, everyone just ends up bumping heads into each other, and you end up very much compromising your patient care. It's just not functional.
Well, again, I think that gets into how are these businesses going to be operated? You hear about a business, you hear about something to go into, especially like take the primary care angle. I know a lot of people that go into primary care. I think it's excellent. When it's executed properly, it's excellent, can really do a lot for patient care. The problem is that when an operator doesn't understand their local market. So I once worked in a hospital, in a very, very rural hospital, and the hospital physicians really controlled the discharges in that community. When a couple of nursing home owners decided they were bringing in a national chain to do the primary care in the homes, then the referring physicians were just like, well, forget that. We're sending to the places that we feel comfortable, where we can still round, where we feel we still have control over the patients. So again, it gets very into how do we actually operate on the ground, and do the people that I'm working with, do they actually understand what goes on in the ground to make this JV or to make whatever business it might be. It doesn't have to be primary care, but whatever it might be, there are specifics in each market that make each business successful.
Yeah, the only other thing that I would leave all of you with is that if one of the purposes of the venture is so that the nursing home person that you're venturing with is going to send you patients and give you business, you have now created an absolute landmine. If there is one email out there that talks about creating a joint venture with the expectation that somebody is going to refer that business to you, stop. Don't even go any farther, because you have infected that joint venture to the point of where the government is going to come in and blow the thing up. The government is laser focused, and I mean laser focused on these JVs. They are laser focused on the transparency of the ownership of the facilities. People that used to hide behind trusts and family members and things like that, that is a thing of the past, ladies and gentlemen. That is not going to happen much longer. You're going to have to disclose everything, and the government is laser focused on it. Now, that doesn't mean that you can't do them. You can do them, and you can do them under the right set of conditions, but they're very, you have to be done very carefully and with experienced individuals.
And just by the way, anybody who's operating out there, or even a vendor or anything, they go for 5 years of your emails. So it's not like there's nothing you could do. It's you got to be clear and straight from the start. It's not you can't hide from the government.
Ken, you see the financial aspect of these things all the time. Are they actually worthwhile at the end of the day?
So I believe there is a lot of opportunity there, but it does split your focus. And as a business leader, you really want to focus on what are you doing as a business owner? How are you making money, and how are you ensuring every day when you get out of bed, you're fully focused on driving value to your facilities? If you start with ancillary businesses and you start getting pulled away, we have clients that literally their entire week are dealing with compliance issues related to these ancillary businesses that they got involved in just to try to capture some of that alpha. It really takes away their focus, and it's frankly our biggest point with Apex. We're always talking about taking that headache away from clients and really doing a lot of work that so they could focus on their patient care.
I think the biggest aspect is you're a nursing home operator. Operate your nursing home. Once you get that under control, then you can start looking at other avenues. But there's far too many groups that walk into a nursing home thinking that I can put this business in, then I can put that business in, but they're turnaround buildings, and you're never going to do that if your head is already looking to the next thing that you can do to capitalize. So focus on your job, do that job damn well, and then start thinking about anything else.
So one of the ways of expanding is by adding additional services. That could be, in one way, in context of ancillaries, which we've just touched upon. It could also be in ways within your facilities' regular services, adding some complementary lines to attract more patients. So in what areas do you see that operators can utilize their access to their current patient population to provide additional services to the healthcare continuum and capture more of the alpha from that side? Alan.
Okay, so what we see very successful operators do is where they have a degree of what I call vertical integration along the entire post-acute care spectrum, where they literally can handle a patient from the moment they leave a hospital to the moment that they go home, and even after they go home. There are a number of very sophisticated healthcare companies that have created what I call a patient navigator position. And that person's position is to monitor those patients as they go out of the hospital and make sure that they are in the right place at the right time for the right amount of time, and that there's not a degree of disconnect between one type of service to another. So what I'm seeing in terms of complementary services is where it all really works together quite beautifully. The nursing home piece of it, the home health side of it, the personal care services side of it, and if you throw in there the nurse practitioner and the primary care, that is where things really work out very, very nicely. And frankly, it puts you in a position when the government is now going to come back and try to push risk in terms of being a value-based system, it puts you in the position of being able to cope with that successfully because you can put the right people in the right place at the right time.
I think just even to get to more of the specifics, like if you're looking in a specific market, take a specific market that, we deal with a lot of rural communities, and sometimes in a rural community you have one guy's like an amazing open heart surgeon that happens to go out to rural North Carolina, and they actually have open heart surgery, and they will draw into one hospital, they will draw all the open heart surgery from, normally in a metro market, every hospital has open heart surgery, but there is one county in North Carolina that has one open heart surgeon who comes twice a week. There's a nursing home there that pulls in a special program with vents and trachs, so they know that there's also a lot of open heart work, and that is a nursing home that is operating at almost 100% capacity. And so it's really about studying what's in the market and what are the specific programs that you could build around, and then do something like what Alan's talking about, and then have a real continuum of care where you're not just giving the discharge planners donuts anymore. I mean, I just coming from the side where I come from in the hospital, like, no one wants your donuts, and we can do things that are a little more sophisticated than that today. Like if you want to be a real player, I think a lot of the homes years and years ago, they didn't have the ability to take care of the acuity of care that a patient has today, and a lot of especially physicians or the mid-levels in the hospitals, they don't even realize the level of care that we can now take care of in the long-term care space. But if that gets marketed appropriately, we build programs around, you actually deal with the physicians that control a lot of the discharge, then those are the types of things that can actually fill beds. And then even better, if we could work on the home side, and how do we do discharge from our nursing home to make sure that the patient has a successful, if it's a short-term stay, how do we make sure that they have a successful home rehab, and then get, maybe some practical nursing once they're home, work with a home care company. Like building that type of continuum of care is the type of stuff that really builds long-term success and makes a home really a player in the market.
Yeah, but that's tough in New Jersey, right? I mean, remember, we're a certificate of need state, so you can only do what you can do, right? You can't follow a patient home in New Jersey, for example. You can't open a vent unit, even if there's a need in the market to do it, because we're a certificate of need state, so you're not allowed to do it. What I would say to you, though, is be careful with what you do. I mean, you might have a hospital that says, oh, we have some behavioral patients that would be great for a nursing home to take in, and you say, oh, great idea, we'll take in the behavioral patients and start a behavioral unit, for the 5 behavioral patients we can take in from this hospital, but you don't have expertise in doing it, you don't have staff that's specially trained to do it, you're not set up to do it, and all of a sudden, you get these people that are very, very difficult to care for, and you don't have the ability to care for them very well. So you get in trouble from the nursing home side, from the regulatory side, because the surveyors come out and you're not doing a great job taking care of them. You get in trouble from the payer side, because those people end up getting rehospitalized because you didn't do a great job in the nursing home. So you're losing money on the rehospitalizations, you get dinged on the survey, and all of a sudden you go, well, that wasn't a very good idea taking those patients, was it? So you really have to know what you can do, and if you're going to set up a special program or you're going to get into a special line, you really have to make sure you know what you're doing to get into it. You can't just dabble, is what I would say.
I think the best example is skilled nursing operators who think they can operate an assisted living community. If I can care for someone who just had open heart surgery, like you said, I should be able to take care of Aunt Susan, but it's really a different world, and you really need to your point, understand what it is that you're there for.
Well, the one that I get all the time is that I get a call from a nursing home owner who will say, I have a really old building that I can't fill, so I'm going to turn it into a drug treatment and addiction center.
I've seen that work a ton of times, and if you have old buildings, absolutely do it. We're financing them up the wazoo. If it's something that you can predict, I'd say the drug and alcohol space is skilled nursing of 7, 8 years ago.
So we're considering a heavy inflationary environment right now. This could really make us or break us. We remain more dependent on reimbursement today, and the reimbursement momentum than we ever were. There are potential scenarios where inflation sinks our industry by continuously adding costs, or alternatively, inflation can cause all the numbers that we know to churn against those operating yields, to churn against higher numbers, and will result in increased bottom lines and much higher valuations. The largest big picture factor, which is going to help determine that, is the reimbursement structures and the federal funding. So what have you seen so far regarding reimbursement momentum in a market? Are you seeing changes in reimbursement structures or just general increased funding? I'm going to start with Andy.
So there are definitely going to be changes in reimbursement structure. Everybody needs to know it's coming, be aware of it. There is an increasing focus on paying for quality, whether it be add-ons to your Medicaid rate, whether it be value-based purchasing in Medicare. The government payers want to pay for high quality. They don't just want to pay a rate and turn and look the other way. You know, I said to a reimbursement specialist who works in this field a couple years ago, you know, the days of us just going to the government and saying, hey, can we have a $100 million increase? Those are over. It just doesn't happen anymore. You have to tell them why you need the increase. What is the money going to go for? You know, in New Jersey, we had a 10% Medicaid increase in 2020, but I think the rule was 60% of it had to be spent on increasing your wages, right? And then last year in the state budget, we got an extra $50 million, but it was toward a quality incentive payment program that has very specific measures. So some facilities that meet the measurements get it, some facilities don't get it. And that's the way payment and reimbursement is going. There's always going to be a base rate because there has to be in Medicaid. But above that base rate is going to be quality-based incentive payments. And everybody has to be ready for those. It's going to be data-driven. You're going to have to do a very, very good job of keeping track of what your facility does. You're going to have to staff appropriately. You're going to have to show outcomes. You're going to have to show process. And you know, with the managed care world, it's a totally different world altogether. You know, you're going to have to show value to those payers. And you know, over the course of the next 5-7 years, you're going to see a lot of change in the way facilities are paid.
I think there's also a interesting difference in the long-term care community than you find in the acute care community. So when I was a hospital administrator at University of Maryland, it was expected that we all went out for the first day of the legislative session. Like, that was an expectation. Every single one of the hospital administrators, like, I'm, you know, like director level and up, I'm saying from the University of Maryland system, there were over 100 people that showed up first day of the legislative session, and we knew the people who were on the ground, who were the local state representatives for our constituents. I mean, we're also constituents there, right? And that made a huge difference. Now, I worked for a public institution, public hospital, and at the end of the year, when we didn't make budget, we went back to the legislature. So that was helpful. We don't do that in this industry. But if we did, right? If there was everybody who was involved in, first of all, they probably have some more minyanim down in Trenton at first day of legislative session. But we have thousands of people that are involved in this space. I mean, there's thousands and thousands of people. There are not thousands and thousands of people going down to Trenton or where I was in Annapolis, or they just don't have that. And if it really is that the presence in numbers would make a huge difference, and I think it really would help rates along. The story out there about our industry is negative. I don't know if you all know that because you're in it, but like, I could tell you from the hospital side, it is not good. And from being in it now, I can tell you that it's not this negative story that's out there. It's not for lack of trying, right? It's that we're in a really hard spot, and the reimbursement is what it is, and it's just, it's a really bad set of public policy and circumstances put together. And we're not going to get out of it by just sitting, twiddling our thumbs and watching, Fox News and praying that we get a new administration. Like, I think people need to get out there and start doing something. I don't know, sorry to get on Andy's soapbox for you.
But you just identified one of my pet peeves, because in my home state of Ohio, the reimbursement system was put into statute. It cannot be changed unless it's done by a statutory change. You know how that happened? That happened after years and years and years of the nursing home industry talking to the legislature until they got there.
And they had to align together, which
and they have to do this. And what we do not do
I think the biggest example is a state like Texas, a state like Iowa, states that haven't changed any aspect of their rates in 10 years. And now Texas just announced that they have a $900 million increase to their base rate. That doesn't mean run to Texas. You know, they haven't gotten an increase in 10 years. They may not get another one for 20. So if you're going to go into new markets, Pennsylvania, exactly. If you're going to go into new markets, don't just look at the states that just got a massive increase. Massachusetts is changing. Is that a state that you should run to? You need to understand each area of this market and game is completely and totally different, and you've got to be really, really prepared for each individual market's expectations and downfalls, frankly.
As somebody who sees operators all over the country in groups, from their vantage point, in New Jersey, and they're trying to operate, I could tell everybody, please don't buy one home in Massachusetts, one home in Texas, and one home in Iowa and think you're going to be able to operate it. It just doesn't work.
If you do, let me know. I'll find someone for it.
What do you mean? It's just about the Medicare rate and the quality mix.
Yeah,
That's
and
what
the
they
other
think.
thing I'll say, just to jump on the point, engage as much as you can. In whatever state you're operating in, engage with your association, engage with your legislature, engage with your local politicians, engage with your communities. Because people listen if we speak to them. If we don't speak to them, they don't listen. A lot of these stories that have been out there about nursing homes during COVID and around that came from people who didn't know anything about nursing homes, right? But they're not going to know about nursing homes unless we educate them. And they do listen if we get out there and speak to them. So the more engagement, the better for our industry.
And everyone should know who the other operators in their state are. They should be talking to them and lobbying together. So whether you're going through the state association or whether a lobbying group like the ambassadors group, there's a lot of ways of working together, talking about your shared concerns, and going and pushing for really getting paid what the residents need to actually operate the facilities properly.
Ken, I think that's a
And
great.
I have to tell you that there's somewhat of a, I'm sorry,
I think that's a great point, Ken. When it comes down to it, there's so many people in this industry that are going through trouble, that are going through hardship, and there are so many people here that have gone through the exact same thing. An old boss of mine, once told me, stop wasting your time trying to figure something out that somebody else already has the answers to. So if we can focus on talking to each other, you can still fly to ECAP on your private jet and still talk to your friend and tell him that, hey, I'm having trouble at this one facility. What do you think I should do? There's no sense in wasting your time. It just cheapens you and your brand. And frankly, I think if we all talk to each other a little bit more, then the industry as a whole would be a whole lot stronger.
Well, the other thing that I want to emphasize is that you got to talk to the regulators in your state. There is a massive disconnect, west of the Hudson, between the regulators in these states and, let's just say, our community, where they know that 25, 30, sometimes 40% of the nursing home beds are owned by people in New Jersey, but they don't know who they are. They come in, they come out, sometimes they fly in private jets. There is a massive disconnect out there. And this is something that we absolutely have to spend time to deal with, because we're going to fail. Unless we deal with the people on a local level, we are going to have a major difficulty coming down the pike.
And if you look at the major Medicaid rate increases in Florida, in Texas, you've had groups of nursing home owners that have banded together to push them through.
And just because you got an increase doesn't mean that your negative $2.5 million one-star building is now worth $40 million.
Yeah, exactly.
Yeah, I guess the same goes for actually showing up to your nursing home. If you're going to come to the nursing home, show up in the morning, leave later, the 1 hour. This always gets me when the operator comes in, the operator comes in, opens a laptop for a couple minutes, closes and leaves. Having presence means actually knowing the people, asking what their names are, getting to know them on the ground. I think there's so many operators that have this terrible reputation for just flying their private jet in, coming in, they came here for 5 minutes, they walked out. It doesn't look good for anybody, right? These people who are working day to day in these homes, it's a struggle. Getting to know some of the people and some of the staff and really engaging with them. There have been a lot of operators who've put a lot of money into this recently to try to really get closer to their staff, to become a human to the staff that's actually on the ground. I've seen that actually change the morale in the buildings, and I think that is something that on the building level, we need so badly.
So true. Being there is more about having your finger on the pulse and checking that box.
Yeah.
We're going to wrap up with one final question. So, do you believe, all considered, that the current momentum on the reimbursement and the federal funding is positioned to outbalance the current economic challenges that we're being faced with? And do you think inflation will make us or break us? We're going to start with Ken.
In case we didn't know, this is also being replayed for the World Economic Forum afterwards.
I appreciate that. Thank you.
Put me and Ken up here to discuss.
No, inflation is extremely challenging, especially in the staffing section of the P&L. We've seen many young operators that are coming in now are really struggling with it, especially if they're coming in to buy their first facility, their first deal. They come in all excited and pushing as hard as possible. They think it's the biggest thing ever for them, and it really is. And they don't have this long-term timeline of, okay, this might be your first deal, it might be exciting, but you're trying to build a business that's going to be here long-term. You're trying to stabilize, you're trying to run properly. They also when they're entering these arrangements, sometimes they're coming in extremely tough and aggressive. You have to come in with the right approach of, okay, I'm trying to run a business first, I'm trying to take care of my residents first, and they're running into this intense inflationary challenge that we're going through. And to answer your question, if you're not preparing for it properly, if you don't go in the deal with the right amount of working capital to prepare to take care of the residents properly, it's going to be trouble, and some people will have significant trouble going forward.
Yeah, I think what Ken's bringing up is something I've seen a lot already, which, I haven't been doing, working in this space all that long, but I've already seen a couple of young guys come in and they're gone. Start an operating group and they're already gone. And I think what is missing, in my humble opinion, is this idea of actually going in and grunting it out. Like, there is a certain amount. You're getting into one home, like, live that home. Go in there. Maybe it's one, maybe it's two homes that they're going to operate. Not starting out and being in, I'm going to be in 30 homes. Now, 27 out of the 30 don't make any money. That's not a way to run a business. Like, you actually have to get on the ground, know what you're doing, craft your craft, and actually do something that's working. And only then are they going to be able to be part of the conversation of value-based care or getting into some of these other market factors that'll actually help them draw higher occupancies.
If you're getting into this business to make money, don't get into this business. If you're going to get into this business because you want to take care of your grandparents, because they need the service, that's a good place to start.
If you want to make money, become a healthcare regulatory attorney.
That's right.
Well said.
There you go.
All right, you're fired.
I want a discount on the next bill, Alan.
Yeah, next settlement statement I see, Benesch is getting tagged.
Yeah, that's it. There are always going to be challenges. Workforce is always going to be an issue. Payment is always going to be an issue when you're talking with government payers. They're never going to pay enough. Those challenges are going to continue to exist. They're going to be there forever. But I believe nursing homes are becoming more important, not less important. Our population is aging. The workforce is not aging with that population that's going to need care. They need facilities to take care of them. Hospitals are not the place to do it. They don't provide the kind of care we provide. There is no other place in the healthcare system for this care to come other than nursing homes. So nursing homes are becoming a more important piece of the puzzle. It's a great business model going forward, but you have to do it right. There are always going to be challenges, and those challenges aren't going to go away.
I think from the inflationary aspect, things will change. Your home will, dollar amount will go up, but everything alongside it will, surpass that. So you really need to focus on making sure that what you're doing right. Just because you got into a new market and a big name gives you a call and says, I have 5 for you to take over, here are amazing terms, the last 4 people that tried failed, but you got this. Take a second to breathe and see if this is really the path that you want to go on. For the new young operators, you'll get judged forever in your career on the first one. So grunt it out, work harder, make less money, it doesn't matter, this is your future. And for the people that keep bouncing around, I can tell you from the bank side of things, it's not easy to get someone young financed when they haven't already stabilized at least 1 or 2 of the buildings that they've taken over. So focus on that first, and then you'll see, the fruits of that a lot later on.
All right. Thank you, everyone, for joining. Please give it up for Ken, Matt, Alan, Andy, and Sim.
Thank you, Chaim.